Hi, ladies. Welcome to another episode of Natural Fertility with Dr. Jane. I'm your host, Dr. Jane Levesque. I'm a naturopathic doctor and natural fertility expert, and I help couples who have been struggling with infertility for over a year get to the root cause and conceive naturally. And I dedicate this podcast to everyone who wants to learn about natural fertility. I explore different topics on why you might not be getting pregnant or staying pregnant and what we can do to optimize your chances of bringing a healthy baby into this world. Today, I want to talk about more of a controversial topic, probably around IVF and the real cost of IVF. I always get a little bit of pushback when I talk about this on my social media, as to be expected. And just know that I'm here to provide the information. I'm not here to judge. I want you to be able to make an informed decision about what is the next best step for you in your fertility journey and in your family, for your family as well. The people that I get pushback from on this topic are ones that if you already have your baby and you had your baby through IVF, there is absolutely no judgment. And though I want you to go ahead and just skip this episode because it's really not for you. The episode is for those of you who feel like you're trying to make a decision. Should I go through IVF or should I give the natural approach a try? And what does that natural approach look like? And does it really work? And what are all the costs that are involved in IVF? And the reason that I want to bring this up is because, very similar to birth control, when a bunch of women were told that there is no issues going on birth control for forever, you're not going to have any side effects. And sure enough, 10, 15, 20 years later, all of these women are now having issues with fertility or during pregnancy or postpartum or even menopause. And we never connected it to birth control until now. All of this research and clinical case studies showing up and saying, oh yeah, it does really deplete all of your nutrients. It really does impact your liver function and your gut function. And it can really screw up your neurotransmitters and the hormones on your own and the connection between the brain and the ovaries. And I feel like when I went to the doctor and he said, you're just going to you can be on birth control for forever, there's no problems. And I was 16 going on it to prevent a pregnancy at that time because I just started being sexually active and met my boyfriend. I knew that deep down he was wrong. He was missing something. It's like, you're telling me I can take a medication for the rest of my life and there's no repercussions to it? That didn't make any sense to me. Even though I was only 16 years old, I had no idea I was going to be a naturopath. I wasn't enrolled in any program in university at that time yet. It just didn't make sense to me. And so when I jumped into the world of fertility, one of the reasons was my sister, who was 36 when she met her husband, 37 when they got married. And so that they just started trying 37 to conceive and see if having a baby was in the cards for them. Now, when she went to her doctor, the only thing her doctor said, they did very little blood work. Like, they just checked to see if she had all her vaccines up to date, essentially, and very preliminary, like maybe some kidney function and electrolytes and a urine analysis, because they wanted to do a culture, but that's it. Like, there was no vitamin D nutrient testing. I don't remember seeing liver function, maybe kidney function, but it was just super preliminary lab work. And she was told at her doctor that, listen, if after 6 months of trying nothing happens, you should just go through IVF and we'll get you a baby that way. And I thought that that was strange that they didn't. That was the first thing that, like, 6 months of trying, because she was already considered a geriatric pregnancy if she was going to have a pregnancy. At that time, they just said, you're going to go and do IVF. So no proper lab work, no proper history. Nobody asked her how long she was on birth control for, or what was her work-life balance and schedule. What did she eat? How much did she sleep? Did she exercise? Nothing, none of that stuff. It was just straight to IVF. And that's when I started to be like, that's interesting. Why are they not looking at anything else? Because I knew my sister obviously very well. And I knew that she was on birth control for 15 years. I also knew that she worked really high, stressful corporate job and put in a lot of hours at work and depleted herself. Her husband was also older. So there were so many pieces to me that I'm like, well, shouldn't we look at this and shouldn't we improve this first, instead of just saying, oh, it doesn't matter, you're just going to go through IVF. And so today, what I see and the messages that I get a lot is women are really trying to decide because they feel the clock is ticking. They feel like that time is running out, and they feel like, if I do IVF, then this is my only option. and to have a baby. And that's it, because my body is shutting down and I waited too long. And there's a lot of self-blame and guilt. And I should have done this earlier. And a lot of anger and resentment as well, especially if you've had some losses or bitterness because people around you are getting pregnant and you can't seem to get pregnant or figure out what's going on with your body. And so I want to present all of the facts around IVF and really set you guys up for success, because I have women who come to me who are like, I need to figure this out for myself. Like, if I never figure this out, I'm never going to be able to live with myself. And a lot of the times it's couples who are trying to have their first child. And so it's like, if they want to have multiple children, she's like, I just want to figure this out, because if I can't figure it out, then like I won't be able to live with myself. And then I have women who come to me who are like, listen, I already feel old. I have that time, that clock is ticking. I need to give myself 6 months, and then like that's it. And then I'm doing IVF. And that's okay too. There's no right or wrong, but I want you to understand everything that you're getting yourself into so you can make that informed decision. And what isn't talked a lot about is not the financial cost that's involved in IVF, and not even the mental and emotional cost that's involved in as well, because that is a cost. It's a huge emotional roller coaster and can be a very, very traumatic experience to go through the retrieval, for example, and then have no eggs that are fertilized, or not even be able to retrieve the eggs, or have a bunch of eggs that are retrieved and then they don't move on to the blastocyst stage. Like, it is an emotional roller coaster and can be very traumatic. So I want you to be aware of all of these things and what you're getting yourself into before you dump a bunch of money into something that potentially will feel like you just threw some money in the wind and nothing happened. And in fact, you got worse because of all the stimulation, all the medication, and just the stress of the whole thing. Now you've gained weight. Now your hormones are out of balance even more. You're losing hair. You're super stressed out. We want to be aware of what we're getting ourselves into and really don't want to rush into it, because even though you feel like, if I don't do this now, my eggs are going to spoil, I promise you that there's so much information now on anti-aging medicine and how we can reverse aging. That's essentially mitochondrial function. And mitochondria is the essence of your oocytes, of your ovaries, and their ability for it to mature and to move on to the next stage. So when I hear a lot of women who have had IVF retrievals and those eggs never matured, that's an egg quality issue, which is really just a mitochondrial issue. And if you think you can't impact that, well, then we want to open up your eyes to this whole world of anti-aging medicine where people are literally aging backwards. And why are they aging backwards? Because they're improving the function of their cells. Aging is when the cell stops functioning the way that it should because it's basically worn out. But if we give the cell and the body the nutrients that it needs, it can function a lot longer than what we think. There's tribes and indigenous communities where menopause doesn't start until mid 50s, if not late 50s. And so when you think about the nutrients and the stress and their practices, you have to ask yourself, well, why are those women still have a good period into their 50s, while women in North America are getting perimenopausal in their early 40s? That's a huge, like, we need to be asking those questions and looking at what are those people doing? And it does come down to the mitochondria. Anyways, IVF, the increase of IVF has been substantial over the last 20 years. I have some studies pulled out in front of me that I want to share with you guys. There's one on fertility trends and comparisons in the historical cohort of US women with primary infertility. So your ovulatory dysfunction and unexplained infertility are going to be the most common causes of primary infertility. And ovulatory dysfunction, we're going to look at the oocyte, and more importantly, we're going to look at the mitochondria. This is where we make the hormones. Mitochondria are really susceptible to environmental toxins as well. So I talk a lot about that in all of my content, but it's essentially IVF increased from 1.8% during the 1980 to kind of 1985 phase to 26% from 1995 to 1999. So from 1.8% use of IVF to now 26%. And that data is still from 20 years ago. That increase is even higher now. because it seems like everybody just needs to get, it's just what we need to do. We just need to get pregnant through IVF. We just need to get pregnant through IVF. And more importantly, we're seeing even more invasive procedures for conception, like intracytoplasmic sperm injection. So ICSI, it has increased from 36.4% in 96 to 76.2% in 2012. And male factor infertility is a huge reason for the use of ICSI, but we're also seeing it for egg quality. And when we're seeing the granulosa cell on the outer shell of the oocyte is too hard, that no matter how strong the sperm is, it just cannot penetrate it. And that's usually because there's a lot of oxidative damage, oxidative stress. And I remember seeing an influencer post that she's like, we're like devastated because the sperm is good and we retrieved a lot of eggs, but none of them got fertilized. And basically, they came to the conclusion that they need intracytoplasmic sperm injection because her egg shell is much too hard for the sperm to penetrate through and to fertilize. But when I looked at her and some of the issues that she's struggling with, so she has endometriosis, she has severe acne, there's lots of inflammation. And so to me, I'm thinking, why are we not addressing this? Why are we not addressing the inflammation? Why are we not addressing the gut issues? She talks, I think, about food sensitivities in her stories all the time, and that she's done the food sensitivity tests and she's done some food sensitivity, like elimination diets, and she's taking CoQ10. And I'll talk about that. But in reality, a lot of the times we're just not doing enough to actually move the needle. And like with natural medicine, we think that if I just pick something up off the shelf, that's it. Whereas CoQ10, for example, depends on the form that you're using. Are you using ubiquinone versus ubiquinol? One is going to be more highly absorbed than the other. So ubiquinol is what we're seeing in research is working the best right now. And the doses can go as high as 600 milligrams a day and even up to 1,200 milligrams. And those little caps are usually 100 milligrams. So when people are telling me that they're taking CoQ10, it doesn't really mean anything to me because, again, we feel like IVF is our last resort. And I really don't think that it is. It can be, but for a lot of people, we're utilizing it a lot quicker than what we should without really realizing the impacts that it has. So we've seen a huge increase in the intracytoplasmic sperm injection. And like I said, male fertility is part of that, but then also the granulosa, the cells right outside of the oocyte that are covering the oocytes, they're much too hard, and so the sperm cannot penetrate it. The big thing here that I'm seeing and the cost that I want to talk about is the health outcomes of the children who are born through IVF or ICSI. And this is something that I think just doesn't get talked about enough because your doctor says you have a healthy baby. But a healthy baby, when the baby comes out, what is a healthy baby? They don't have any genetic malformations. They look fine. They don't have anything else on their face, or like their organs seem to be functioning fine. That is a standard for a healthy baby. We don't know, we don't look at the microbiome. We can't see if like what their immune system is. All of that stuff is going to start to come out a little bit later. Okay. So you're not going to, when a baby is born, there is, of course, markers that we want to see of the heart is functioning the way that it should, the kidneys, the baby's pooping on a regular basis, the baby is peeing on a regular basis, they're not turning yellow, it's a sign of jaundice. But like that's basically the standard of health for a baby. And I remember I always call the babies the naturopathic babies when they're born because they have a little bit more glow and their eyes are really bright and they look at you basically the moment that they're born instead of being really sleepy. And there's no rashes, there's no eczema, there's no rashes, there's no cradle cap, or very little if there is any. And there is a difference in what you're looking for and what we've considered normal. Now, I want to empower women to help them understand so they can catch things earlier, whether it's catch things earlier in themselves or catch things earlier in their babies and in their kids, because my kids have stuff, but I'm able to catch it and get rid of it right away instead of pushing it aside and letting it develop into something more serious. And so when the babies are born, this is a study from the health outcomes of children born after IVF and ICSI, a review of current expert opinion and literature. And this is from 2014, so it's still like 10 years old, but IVF-concealed children have lower birth weight and higher peripheral fat, blood pressure, and fasting glucose concentration than controls. So we are seeing that the babies who are born through IVF and ICSI are a little bit more stressed. Okay. That's all I would say is they're a little bit more stressed. And now the argument here is we don't know if it has something to do with the procedure itself versus it's the women and the men who are trying to have the babies and they are older. So the women generally are older, the males are older. And so we don't know if it's the procedure that's causing the issue itself, or it's actually just because what we're taking the egg and the sperm that wouldn't ovulate, that wouldn't necessarily ovulate, but wouldn't fertilize on its own, and we're forcing that fertilization to happen. So we don't know if it's because there's the force versus all the medication and everything else that happens, or if there's something in the female. This is where, as a clinician and as a natural fertility expert, I'm thinking that if your mitochondria, whether it's for male or the female, isn't up to par, isn't where we want it to be, so that ovulation couldn't happen on its own, that fertilization couldn't happen on its own, you can only pass on the best of what you have. And so if the best of what you have couldn't have done it on its own, everybody is a different case. Okay. So I'm just going to talk about generals. And if you want to know a little bit more specifics, then send me a DM and I'll try to fill you in. But the idea here is that if it couldn't do it on its own, then something was missing. And where usually this is where I'm looking at the mitochondria, because the mitochondria is the essence of basically anti-aging, but it's also the essence of our fertility for both males and females, because the embryonic development is such a high energy output that if that wasn't working the way that it was supposed to be working, the body is still incredible and it's going to do the best that it can, but it tends to be missing something. Another paper, the contemporary use of ICSI and the epigenetic risk to future generation. Basically, the collected data concerning the health of the ICSI children over the past 30 years seems to support the notion that there might be an increased risk of epigenetic disorders, congenital malformations, chromosomal alternation, and subfertilities in babies born following ICS compared to naturally conceived children. So one of the courses that I just took, she talks about the transgenerational effect of fertility. So when your eggs, if you're a woman listening to this, your eggs were developed when your grandma was pregnant with your mom. Just think about that. Your eggs were developed when your grandma was pregnant with your mom. And so they did this study it was like a Dutch study that they did. And there was a lot of, I can't remember the year, but basically they followed the Dutch women. There was a period of starvation. I believe it was during the World War II. And it wasn't the grandparents, that generation, it wasn't those women, their daughters didn't have the fertility issues, but it was their daughters' daughters that had the issue. So it's fascinating, but we as women pass on, like when I was pregnant with my daughters, I'm actually passing on their eggs and their oocytes are developing at the time to then be able to have children. So I'm passing on my mitochondrial DNA, if you will, to my grandkids. And it's fascinating to think about that, because when we look at these procedures and the essence of fertility is mitochondrial function, and we need to improve it and understand why it's not working well and remove the reason that it's not working well. To me, there's no surprise that women now, because IVF has skyrocketed. So 1999, from 95 to 99, now it was a 26.2% use, and now it's even higher. And so all those kids who were born through IVF in the 1990s now trying to have babies are going to struggle to have babies because they never had that genetic code that was passed up, right? The mitochondria. So I always like to zoom out and look at what's happening. What's the root cause of this? Because it's not just about you having a baby. It's really about having a healthy baby. And I mean, genuinely just passing on this generational health, because what's happening is we're passing generational disease now. And it's taking a lot of work for some of these poor souls that I work with to reverse it. And it feels devastating and hopeless and powerless at times. But when I look at these data, I know that the couples that I'm working with who really want to try to figure out how to do this naturally, or ones that have a limited time, but really want to prepare themselves and do the best that they can before they do any extraction of the eggs in the retrieval and go down that road, that they actually set themselves up for success. So they improve the function of the liver, they improve the function of the gut, and they boost their nutrient levels. And I mean, like really, really boost it. because the last thing that I'll talk about, like this is the stuff that I think is the real cost, because I have kids and I just want the best health for them. And I think when we want to become a mom, we don't want to just be a mom. We want to be a really good mom. We want to feel like we're taking care of our children. We know how to take care of them. We can support them, or we can love them. And we're not going to be able to support them through every stage in it. But for the first couple of years of their life, you will be, their lifeline. And I think it's one of the worst feelings as a mom is when we have no idea what's going on and we don't know how to help our kids. I feel that when my daughter is going through an emotional growth spurt and I have no idea what to do or how to be there for her. And this is usually when I go into, whether it's I go into counseling or I get some help and support. But health is not an issue that I face with her, because when something is going on, I have the tools and I feel really empowered to be able to help her and to show her that this is how often you should be pooping and this is what you should be eating. And she takes her supplements. They both take their supplements. The older one I can teach her more because she is older, but it's a very empowering process to be able to, like, I will teach her what the menstrual cycle is and what's good and what's not good, and that there is no shame around it. And what actually instead that we should be really honored and empowered by this process. And it's a celebratory event as opposed to this thing that we need to hide. And I think we're all missing that right now. I think we're really just giving up on our bodies and jumping into these procedures that are really financially draining, but there is actually another cost to it as well. The other cost that I was going to talk about is women who go through IVF or ACSI. So like any of these procedures, there are at higher risk for developing preeclampsia, for developing gestational diabetes, for going into early labor, for having to go and having a C-section. And again, the question is, well, is it because they're older, or is it because they're missing some nutrients and some like vital components that the body absolutely needs? And it's critical for it to be able to not just get pregnant, but to stay pregnant and to carry that pregnancy to term. Why do we see so many issues in the third trimester versus like the first trimester? Yes, it's just to make sure that the body can hold on and the placenta and everything forms and the baby can start to form and grow. The second trimester is usually when things ease off. But in the third trimester, why we start to see all these complications, because the body has now been pregnant for 6, 7, 8, 9 months. It's a lot of pressure. It's a lot. There is a higher blood volume. Now the baby, instead of it being a size of a grape, it's the size of a watermelon, a small watermelon, of course, but that's a lot. That requires a lot more nutrients to be able to sustain that. And then of course the changing shape of the pelvis and where the organs need to move and the breasts and preparing for milk production. There's so many things that are happening that we need to be aware of. So I hope you guys found this podcast helpful. I know that this is a controversial topic, but I think it's so important to talk about it so you can make an informed decision, because I have a lot of women who will question if they need to keep going naturally or if I should just go ahead and do IVF. And I think this is where I really rely on data, both like I'll test my patients so they have data. I'll look at them. I look at the Aura Ring findings and I'll look at what is the stress level on their body. How well are they sleeping? And then we look at the blood work and we look at the stool analysis. We look at the environmental toxin, because there's always a reason as to why the body is not doing it yet. And then, of course, there's the energetics of it, because we put a lot of pressure on ourselves. I see women who are working jobs that they hate, or even sometimes in relationships where they don't feel supported or that they can really trust their partner and their nervous system can really relax. And so that's going to be a block for some women to conceive. And for some of it, it's all of the pieces. And we need to continue to move those pieces as the body evolves and heals. And so the body is constantly changing and evolving. And I think it has to just come down to you, what you're comfortable with, because as long as you're at peace with your journey, it doesn't really matter what you decide to do. Like the judgments of other people doesn't matter. As long as you understand what you're getting into, you understand why you're making the choice, and you've done the best that you can to prepare yourself, then everything else is just noise. One of my mentors always says, it's like, it doesn't really matter what people think in terms of what I'm going to do. I'll always know. I'll always know if I did my best. I'll always know if I cut corners. And so I think this is the same thing with fertility. You have to know deep down inside that I did put everything that I could into X, Y, and Z, and it's time for me to move on, or it's time for me to sign up for this procedure. Because some women will have this internal voice that says, no, like, you're going to figure this out. And so they're going to follow that. And then there is women who are like, I just want to have a baby, but I want to do the best that I can. And so, like, tell me what I need to do, how to detox, how to clean up my environment, how to optimize my nutrients. But I have a date in mind. And by that date, I'm going to go in no matter if the pregnancy happens or not. So there is no right or wrong here, you guys, but I do want you to understand what you're getting yourself into and to really prepare yourself, because it's not just about, like, one of my pet peeves with IVF is like, oh, you're pregnant. And after like 8 or 9 weeks, sometimes they don't even take you to the full first trimester. They just let you go. They're like, you're good now, baby's on. But in reality, there is, I test through pregnancy all the time because I catch things all the time, whether it's your iron really drops or your liver enzymes start to spike or your blood pressure is changing, or the cholesterol and inflammation. The more we can support the body, the better the outcome will be. And you don't have to wait until there is a quote unquote emergency. You can actually just test on a regular basis and track the data. And I think that the conventional system is not really doing that right now. So we do have to seek it out ourselves, and we have to have that desire to learn, because if you're one of the lucky ones who have had a great conventional doctor that really tracks all the data and helps you explain things, even incorporate some nutritional coaching and CoQ10 or whatever, like other uh, supplements to really help set you up for success. It's like, that's great, but that's not what I'm hearing about in the majority of cases. A majority of people have no idea what they're getting into. Majority of people are getting told that they need IVF meanwhile, they have 50 to 100 pounds to lose. They have dysregulated blood sugars. They have no gallbladders and terrible digestion, just constant diarrhea. Their vitamin D is super low. It's like, these are such important and critical nutrients and function of the body that if you're already in this high point of stress, like, it doesn't make sense to do IVF. IVF is just this really big, expensive procedure that's just going to pull out the best of what you got, but your body still has to do the work. And so if your body is depleted and tired and doesn't have the nutrients, it's not going to be able to do that work. When we put in the work and we really dump a lot of nutrients on the body, then the pregnancy is a really beautiful byproduct, and it just happens on its own. And then the pregnancy itself is smooth, and there's a lot more trust in the body for the female. There's a really healing. One of my patients right now, she's pregnant and she's struggled with infertility for 4 years, and she's really going through the trauma of infertility now, because she's doubting her system all the time. She's constantly worried about her baby. Oh, I shouldn't do this. I shouldn't do this. I'm going to hurt the baby. Is this bad for the baby? Is this? And so the trauma of infertility shows up in different places. And I think if we can just focus on healing and making decisions from a place of knowledge and support and, like, not emotional. You don't want to make decisions when you're in a highly emotional space. Those decisions are not going to be very good. You want to make sure that you calm down and you have the space and time to think before you move into whether it's any kind of procedure or surrogacy, or it's just give yourself some time to breathe and let the emotion pass before you make a decision. And like I said, work with a practitioner who's going to help you. I hope you guys found this helpful. Let me know if you have any questions, and please send this to somebody that you think is going to find it helpful and support them through their journey. Like I said, I'm really passionate about helping women take control of their fertility journey and feel more empowered through the whole thing. And if you want to apply to work with me, click the link down below for Maximize Your Fertility program, and I'll show you what that looks like. Thanks so much, you guys, and we'll see you soon.